Hey everyone, it's Melissa again. I wanted to hop on and create a quick video for you guys just to discuss the therapy process when working with children. So sometimes I have people who ask me, would therapy be appropriate for my child? And so I just wanted to talk with you guys a little bit about that so that you can make a well-informed decision about whether or not your child might need therapy. So the answer to the question, is therapy appropriate for children, is yes. We can do therapy with children, and some considerations for therapy with children are: what age is the child? Has that child met developmental milestones up until this point, or has that child had a little bit of struggle meeting certain milestones? What type of stressors is that child under? What is the family dynamic for that child? What does that child's life and environment look like? And also, thinking about the age of the child, therapy is going to look different for a child depending on that child's age and that child's personality. So for younger children, when therapy is incorporated into their life, it looks like play therapy a lot of times. And so what that can look like is acting out certain situations or using play toys and tools to help that child to express things that they're feeling and things that they're afraid of. Artistic therapeutic interventions and drawing pictures and painting, teaching that child coping mechanisms and ways to move their body to release some of the pent-up anxiety and the emotions that they're feeling. Also teaching that child safe ways that they can express emotions. Oftentimes, children are taught, don't do this, don't do that, don't kick, scream, yell, don't hit your sister, don't do these things. Sometimes we don't teach our children, those are the ways that we cannot express our feelings, but these are the ways that we can. And so part of therapy is, yes, you cannot do these things because you get in trouble and there are consequences, but here are the things that you can do that are acceptable. And these are ways that you can feel and express your emotions that are not going to get you into trouble, that are acceptable, and that you can, release some of that pent up emotion and express it. Another part of therapy for younger children is teaching children what emotions are. What the sensation feels like in the body, and how to identify and name that emotion, and how to be able to communicate that emotion and say, I feel very angry, I feel very sad, I feel very frustrated, I'm anxious, whatever that could be. Also, if the child is like adolescent age, just understanding stages of development and talking about during this stage of development, these are typical behaviors for a child this age. And this is how the parent can best support this child. This is how the child can best express. These are tools and tips and techniques for ways that you can open up that communication with that child and allow for a stronger relationship with the parent to be able to have a healthy communication style and to be able to work through some of those things. Now, sometimes the parent has to also work in therapy. Sometimes everything doesn't just fall on the child. And so, yes, the child is working on their interventions and their coping mechanisms or whatever the case might be. But then at the same time, the parent is also working on some different approaches with the child. Now, children have different personalities, and some children are very eager to please their parents and they submit to authority easier. Some children are very, very strong-willed, and it is much more difficult to get them to buy into what you're asking them to do and to come alongside you and do the things to keep so much chaos from coming out of the relationship. So you have to take into consideration that child's personality. We can't change personality. We can teach better ways to use strengths and better ways to cope with things that might not be a strength for that child. So yes, therapy is appropriate for children, even, up into 18 years of age, different life stages, they're going to face different types of stressors. Another thing for consideration with therapy with children is if your child is involved in sports and you've noticed that your child is experiencing a great deal of anxiety around the performance of that sport, specifically thinking about sports that are the child is performing in a very individual way, where all of the attention and focus is on that child at one time, those type of sports can be very, very stressful. And the stress of what the child is dealing with in school and the stress of what the child is navigating at their home with their family, and then you add sports to that and the pressure to perform, and a lot of emotion is involved in sports. If you've ever been to a basketball game or a baseball game, if you've ever been to a volleyball game, any type of sport, and there's a lot of competitive spirit, you know that there can be a high level of emotion, and sometimes that level of emotion is more than what that child can manage and cope with, and so you'll see behaviors come out. Now, the last thing that I want to talk about in this video is just to help parents understand that when a child is acting out behaviorally, a lot of times that is because there are emotions that are driving that behavior. So sometimes, well, most often, our children won't come to us and say, I'm sad, I'm angry, I'm frustrated, I'm stressed, I'm anxious, I'm worried about my future, I don't feel like I measure up, my self-esteem is hurting, I don't feel like I'm good enough, help me with these things. Children don't have the tools to be able to communicate in that way. So what you'll see in children is there's a high level of frustration, and then you'll see behavior. You'll see rebelliousness. You'll see they're getting in trouble at school. You will see that maybe they're not deliberately disobeying you. Maybe they're not saying, I won't do this, but then they are not following through with the things that you're asking them to do, which is also behavior. Maybe you see some isolation and they're pulling away from you and from the rest of the family. So those are some considerations for children. And then also with younger children and even adolescent and high school age children, a lot of times when there is an underlying emotional problem, not necessarily a problem, but just an emotional response, you will hear things like, I have a headache, I have a stomach ache, I don't feel good. They have these somatic complaints that come out because they don't even realize that what they're feeling is an emotional response. It is showing up as a physical response in the body. So if you have a child who is frequently sick to their stomach, they're complaining often about, I have a stomach ache, I have a headache, I just don't feel good, I'm tired. You have a child that's coming home from school and then going straight to bed and sleeping until supper, eating and then going back to bed, those kind of things. They show up in a physical way, but our emotions can show up as physical problems. And so if you take that child to the doctor and the doctor is saying, we can't find anything that's going on, lab work looks good, everything's checking out, we don't know what the issue is, then it might be a good idea to talk to a therapist, because there may be some underlying things that are going on. It's safer for that child to say, I have a stomach ache or I have a headache, than it is to say, this thing is going on at school and I'm, kind of being picked on, or I feel like I don't fit in, or, different things. So those are some good things to keep in mind when considering therapy for your children. Again, therapy is not just for people with a specific diagnosis. Everybody needs a therapist at some point in time throughout life, because life is very, very hard. We face a lot of challenges and a lot of stressors. Sometimes the world will tell us just to step it all down, keep moving forward, pull yourself up by your bootstraps and keep going, especially in the region that we live in, because we have come from very hardworking people who had very hard challenges that they faced, life-threatening challenges, and they didn't have time to talk about their emotions. They just had to get in there, get it done, and make it happen and move on with life. And so we still carry some of that from our heritage to be strong people and to move forward. But at the same time, if we're not taking care of ourselves emotionally and we're not releasing the emotions that we're carrying, then eventually those are going to weigh us down. So you guys have a great week, and reach out to me if you have any questions or concerns about anything, or if you feel like your child may need some therapy. You can reach me at southerntherapy@gmail.com, and I'll look forward to bringing you guys some more videos and some more community resources. Have a great week.